Hello everyone! Today we'll be discussing hepatitis B virus infection, a significant global health issue. Hepatitis B is a viral infection that affects the liver, causing inflammation and potentially leading to severe complications. Hepatitis B is caused by the hepatitis B virus or HBV, which is transmitted through contact with infectious blood or body fluids. This can happen through various means such as unprotected sex, sharing needles, or from an infected mother to her baby during childbirth. The symptoms of hepatitis B can vary from mild to severe and may include fatigue, jaundice, or the yellowing of the skin and eyes, abdominal pain, nausea, vomiting, and dark urine. However, it's important to note that many people with hepatitis B may not experience any symptoms at all, yet they can still spread the virus to others. Chronic hepatitis B develops in individuals who fail to clear the virus within 6 months of acute infection. Chronic infection can lead to serious complications including liver cirrhosis or the scarring of the liver failure, and hepatocellular carcinoma, making it a major cause of liver-related morbidity and mortality globally. Now, let's dig deeper about the mother-to-child transmission. Transmission during childbirth. Infants born to HBV-infected mothers can acquire the virus during childbirth. Transmission can occur if the baby comes into contact with the mother's blood or vaginal fluids during delivery. If a mother is positive for the surface antigen of the hepatitis B virus or HBsAg, there is a risk that the virus can be transmitted to her newborn during childbirth. This transmission typically occurs through contact with infected vaginal blood at birth. Risk to the newborn. Hepatitis B is a serious illness, and infants who contract it from their mothers have a high likelihood or greater than 90% of becoming chronic carriers of the virus. Chronic infection can lead to liver complications, including liver cancer later in life. Preventive measures. To reduce the risk of transmission, several preventive measures are recommended. Immediate bathing. The newborn should be bathed as soon as possible after birth to remove any HBV-infected blood and secretions. Gentle suctioning. When cleaning the newborn's mucous membranes, gentle suctioning is necessary to avoid trauma, which could allow the HBV to invade the baby's system. Administration of serum immune globulin, or HBRG. In addition to bathing and suctioning, the infant is given HBRG, which helps to provide immediate protection against HBV infection. HBV vaccination. The newborn is also vaccinated against hepatitis B at birth. This vaccination further reduces the risk of transmission and provides long-term protection against the virus. Diagnosing hepatitis B involves serological tests to detect HBV antigens and antibodies in the blood. These tests help determine the infection status, disease stage, and potential need for treatment. While there is no definitive cure for hepatitis B, several antiviral medications are available to suppress viral replication and reduce the risk of disease progression. Management strategies focus on controlling the infection, minimizing liver damage, and preventing complications. Prevention is paramount in combating hepatitis B. Universal vaccination, starting from infancy, is the most effective preventive measure. Additionally, promoting safe sex practices, avoiding needle sharing, and ensuring the safety of medical procedures are crucial in reducing transmission rates.
Make sure you are vaccinated.
By raising awareness and taking proactive measures to prevent HBV transmission, we can reduce the burden of hepatitis B and improve the health outcomes of individuals worldwide. Now, let's move on to our next topic, Ophthalmia Neonatorum. I'm here to shed light on a significant neonatal condition known as Ophthalmia Neonatorum. Ophthalmia Neonatorum, also referred to as neonatal conjunctivitis, is a condition characterized by eye discharge in newborns. Let's delve deeper into its causes, symptoms, diagnosis, and management. First off, what is the conjunctiva? The conjunctiva is a mucous membrane that lines the inner surface of your eyelid and the outer surface of your eyeball. It covers the sclera, but it does not cover the cornea. It stops at the limbus. Inflammation of this membrane is called conjunctivitis, and this will give you a red eye or a pink eye. Since the conjunctiva does not cover the cornea, and it does not interfere with light rays entering into your eye, conjunctivitis for the most part does not affect your visual acuity. Your eye is going to hurt, but you will continue to see. After delivery, doctors usually give topical erythromycin ointment or tetracycline ointment or silver nitrate drops. This varies from country to country. Why do doctors do this? To prevent Ophthalmia neonatorum or neonatal conjunctivitis, especially that one is caused by gonorrhea. Ophthalmia neonatorum primarily occurs due to the bacterial or viral infections transmitted from the mother to the newborn during childbirth. The most common causative agents include Neisseria gonorrhea, Chlamydia trachomatis, herpes simplex virus, and less frequently, other bacteria such as Streptococcus pneumoniae and Staphylococcus aureus. Ophthalmia neonatorum or neonatal conjunctivitis can arise from various factors, including chemical irritants, bacterial infections, and viral pathogens. These factors can lead to inflammation of the conjunctiva, resulting in the characteristic symptoms observed in affected newborns. So now let's answer this question. When did the conjunctivitis can give you a clue regarding the cause of the conjunctivitis? If it happens on day 1, it's usually chemical conjunctivitis caused by the ointment or the drops that you just gave to the baby. If it happens on day 2 or after, it's usually bacterial. If it happens 14 days or after 21 days, this is probably viral conjunctivitis. However, the bacteria is divided into 2 groups, include Neisseria gonorrhea, usually between 2 and day 7, and then Chlamydia trachomatis between 7 and day 21, herpes simplex virus or HSV. Is it HSV1 or HSV2? Since it's neonatal conjunctivitis, the baby got the virus in his or her eye from the mother's vaginal canal. And as you know, generally speaking, HSV1 is above the waist and HSV2 is below the waist. Since the vaginal canal is below the waist, this is the herpes simplex virus 2, and now the baby has HSV2 in his or her eye, and this is called herpes simplex conjunctivitis. And that is why if the mother has herpes, do not perform vaginal delivery. You should do a C-section to prevent HSV conjunctivitis. Because as you know, once the baby has HSV, it's not going away. The symptoms will come and go, but the virus will stay. It remains dormant. Number 1. Chemical irritants. Immediate irritation and burning sensation in the eyes upon exposure to the irritant, redness and inflammation of the conjunctiva, excessive tearing or watery discharge, swelling of the eyelids, sensitivity to light or photophobia, and temporary blurred vision. It is mild. Number 2 is Neisseria gonorrhea infection. Severe eye redness, profuse purulent discharge from the eyes. What does purulent mean? Purulent mean is same as pyogenic, suppurative, and is the same as pus. Tons of pus in the eyes with significant ocular swelling. Eyelid edema or swelling, conjunctival hemorrhage or bloodshot appearance, corneal involvement leading to ulceration in severe cases, and possible systemic symptoms if the infection spreads beyond the eyes. Chlamydia trachomatis infection. The symptoms are moderate to severe eye redness, watery or mucopurulent discharge from the eyes, swollen eyelids, follicular conjunctivitis characterized by tiny bumps on the conjunctiva, potential involvement of other mucous membranes in the body. In some cases, infants may be asymptomatic carriers. If it's chlamydia, it can be watery discharge, not purulent discharge, or it could be mucopurulent with some ocular swelling. Who makes pus? The neutrophils. What is the function of the neutrophils? To protect your body against bacteria. Do neutrophils protect my body against viruses? They do not. Herpes simplex virus or HSV infection. The symptoms are eye redness and irritation, watery discharge from the eyes, pain or discomfort in the affected eye, swollen eyelids, vesicular lesions on the eyelids or around the eye, corneal involvement leading to dendritic ulceration, symptoms such as fever and malaise in severe cases. That is why if you have a virus, you will have a non-purulent discharge or with no pus, because pus is made by neutrophils, and neutrophils only defend your body against bacteria, not viruses. Vesicular lesion. Whenever you have HSV, you can have vesicles. Do you remember shingles? Shingles was caused by herpes zoster virus in the same family, and shingles also has vesicles. Chemical irritation or chemical conjunctivitis. It is caused by the ointment and not an allergic reaction. Its treatment is to irrigate the eye with saline. Next is Neisseria gonorrhea. Prophylaxis is topical erythromycin or topical tetracycline ointment. For its treatment, ceftriaxone, which is a third-generation cephalosporin. For the chlamydia trachomatis, you cannot prevent it with ointment and it's not very effective. For its treatment, it is oral, not topical, oral erythromycin or azithromycin. These are macrolides. Macrolides are a class of drugs used to manage and treat various bacterial infections. Macrolides are erythromycin, azithromycin, and clarithromycin. Herpes simplex virus or HSV infection. For its treatment, it is a systemic medication and local medication. So for systemic medication, that is acyclovir, and for the topical, this is vidarabine. In addition to the specific preventive and treatment measures, practicing good hygiene, such as frequent hand washing and avoiding touching the eyes with unwashed hands, can help reduce the risk of conjunctivitis transmission in general.